be giving a pre- Today I'll be giving a presentation discussing on how to support the physical health and well-being for people living with dementia. Just want to mention that Empower Healthcare is a multidisciplinary team offering allied health services in the community. We do in-person services and telehealth services. So if you're interested in any of our services for a client, please contact our office. Since we're talking about how to support the physical health and well-being in dementia clients, we need to know what dementia is. So dementia is a term for several diseases that affect memory, thinking, and the ability to perform daily activities. Now, dementia is progressive due to loss and damage to the neurons, which is the brain cells. The most common one, which most of us have come across, is Alzheimer's disease. And there's also other ones such as vascular dementia and Lewy body dementia. The symptoms of dementia include memory problems. So an individual may find it harder to recall recent events, people, or even names of things. They'll have thinking difficulties. So it becomes difficult for them to complete everyday tasks because it's harder for them to plan or problem solve or concentrate. An example of this would be like keeping track of their diaries, wallets, appointments, or even remembering how to go around the neighborhood. We also notice changes in mood, where they might find themselves feeling less social, more prone to feelings of depression, agitation, or even anxiety. Lastly, there's changes in their behaviors as well, where they may start saying or acting in a manner that is not their usual self. For example, they may start to wander or yell out or be agitated in the presence of familiar people. Now, these cognitive changes are well known for dementia, but what about the physical changes associated with it? So, as dementia progresses and combined with the potential medication interactions, low motivation, and prolonged inactivity and the dependence of others to do their tasks with, this can result in loss of muscle strength and coordination. This can lead to also reduced balance. So changes in the balance increases their associated risk of falls. There's also going to be changes to their overall mobility with the loss of the muscle strength, the balance, and they may gradually lose the ability to walk or even complete daily tasks such as standing up from a chair. They'll also have increased muscle stiffness and joint immobility. Now, more advanced dementia clients with poor cognition are more likely to develop contractures. So, what can we do to help counteract some of these physical changes? Exercise. Now, you guys might be wondering what might be some of the benefits of exercise. We know that there is evidence to suggest that individuals who are physically active throughout their lives are less likely to develop dementia. This is because exercise helps to keep the brain healthy by promoting your thinking and memory through the reasons shown on the slide. So we'll go through the slide. So exercise stimulates the growth of new brain cells. It protects brain function, supports oxygen supply and blood flow to the brain. It reduces falls risk by building your muscle strength and working on your balance. It also improves social engagement. Now, I also want to mention that it is better late than never to start exercise, as it still provides these benefits. So if you have a client, you can use the slide to support why exercise would be beneficial for them. So what are the specific physical benefits of movement and exercise for people with dementia. So exercise and movement helps keep the muscle strong. It improves agility, improves joint flexibility, and it helps clients stay more independent with their day-to-day tasks, such as being able to stand up from a chair or being able to comb their hair. Secondly, exercise helps to build up endurance through the improvement in the cardiovascular system, which in turn assists with their mobility and the distance they can walk. Some examples of this will be helping clients go on their daily walks or the ability to maintain their daily outings with family and friends. And with the points we just discussed, all these improvements may assist with lowering risk of falls, which is a major concern for people with dementia. We know the risk of sustaining major injuries from falls, such as hip fractures, can result with the immobility of an individual, and they may even need to go into care, or this might even increase the amount of support they need at home. So it's better to have people participate in exercises so they can so we can minimize the risk of falls. So what are the cognitive and psychological benefits of exercise and movement for people with dementia? So physical activity and exercise can stimulate brain function and supports memory retention. It also improves mood. So improvements in mood may assist with their social engagement. And completing physical activities in groups may reduce isolation and provide social stimulation, which helps to achieve a better sense of purpose for them. And success in completing tasks, even like simple ones, builds confidence and positivity in the person. And moreover, exercise and physical activity can help manage restlessness or agitation, which is common with people with dementia. And this may also assist with their quality of sleep. Now that we know the evidence behind physical activity for the well-being of an individual with dementia, how do we implement this? So we want to find movements and exercises that are right for the individual. This means that there is no one right answer. Here are some examples of physical activity. So cardiovascular exercises, this could be walking, running, cycling, or swimming. We got strength exercises. This could be seated exercises or joining an aerobic class, lifting weights, or going to the gym. We got balance exercises, such as doing standing balance exercises, Pilates, Tai Chi, and flexibility, which is doing stretches. But this is easier said than done. We know that people with dementia present differently, and their level of cognition will affect their ability to participate in the above physical activity examples. So we want to find other ways we can get them to participate. So functional ways, so which are things that they might be doing daily or relevant to their daily activities, is another way we can get them engaged through functional activities. So these are some examples of everyday movement opportunities which we can incorporate into exercise or physical activity. So for example, cardiovascular system, walking up and down the stairs, bringing the shopping in, taking your dog for a walk, and placing familiar items around the home to collect, you're still working the cardiovascular system. You also have strength-based everyday movements. So this could be household chores, such as lifting a laundry basket and rearranging the cupboard by lifting cans, items. You're indirectly still working your strength through doing that. And also balance. So you could involve components of some of the balance exercises or tests in things such as dancing. And even things like putting your clothes up on the washing or hanging it up that still works balance. So there are different ways we can implement exercises to different clients. It has to be individualized. Now, it's still easier said than done because there are challenges still. We want to get people doing as much exercise as we can, but we also have to know what are some of these challenges and why. So we'll go through the slide. So due to the cognitive decline, people living with dementia may have difficulty understanding instructions. Example, they may forget what to do, or they might be confused on how to complete an exercise. They may lack interest or motivation to participate in activities. They may have behavioral changes such as agitation or lack of interest. They're also at risk of injuries, especially if they don't perform the exercise properly or they have physical limitations such as joint impairment or gait impairment that affects their walking, putting them at risk of falls. So, how can we address some of these challenges? So, I got some tips here that will be helpful if you're seeing clients with dementia or want to provide advice to some of the other staff. So, one of the best ways to get people with dementia engagement is quite important. So, we want to find the client's or individual source of motivation. And the best person to do this is by asking their family members. If the family members are not present or not that involved, you can ask one of the regular carers. They can ask, what kind of things this client or resident like to do before. And you can make exercises or tasks based on that activity they like to do. So for example, I used to have a client who used to like playing tennis. And what I did was I made an exercise involving a racket and the balloon. So we used to play balloon tennis. And that already built up her motivation to do exercise, and she was participating with other exercises after that. And other tips is to be aware of the communication. You want to always approach calmly. You want to keep your communication very simple and direct. So instead of saying, flex your wrists, supinate your elbows, I would say something like, face your palms up, bend your elbows, bring it to your shoulders. That sounds more simple. And if they're still not doing that, it's good to give the visual cue. It's just another stimulus they can use to do the activity. And of course, patience is key. Give them some time to do it or repeat it as needed. Now, we want to provide individualized care. So we want to be sensitive to the person's cultural background. For example, if they don't want to do exercise alone in the room, we have to respect that. So maybe we'll need to have a family member or a support staff or someone there if they prefer that. Use supports as needed. Some clients like to have dolls or even mechanical pets. So we would respect that. We would allow them to have it if that's going to give them the engagement they need in the exercises with us. And we also want to consider the timing of the program. Some people have sundowning and they may not be responsive to physical activity or even instructions late in the afternoon. Therefore, we generally aim to complete exercises or physical activity in the morning. Just some more other tips when we're doing exercises. We want to keep our sessions short. So short bursts of activity are often more manageable and less overwhelming for them. And routine is good. Establishing a routine is great because it provides structure and predictability. However, that being said, if they are not responding well to some of these routines, we might have to consider trialing something new. And we want to make our exercises and activities fun for them. That's how we get the engagement. So We can use things such as music, which can be motivating for them, or even doing tasks that are familiar, which can be easier for clients with dementia to engage with. And we want to give gentle encouragement without forcing participation. And I recommend they join group classes. So with other residents or other clients in the community, or even involve family members. I had really good participation when family members are involved and they're doing the exercises with the resident. Now, it's all good and everything. We want people to exercise, but safety is number one. We don't want them having a fall or anything that might lead them go to hospital and declining in their function because of that. So safety is always top priority. So we want to make sure that we remove any tripping hazards. So clear the pathways by removing loose rugs and cords. Ensure non-slippery floors. We want to make sure we have good lighting. This reduces visual confusion. We want to make sure the furniture is stable, not broken. If they're doing certain exercises such as sit to stands. Some clients are doing the sit to stands using the dining chair. Now, if they're using that, we want to make sure that the chair is against the wall, because what I notice is when we have clients using the regular dining chair, the chair keeps moving back as they do sit to stand, standing up, sitting down, and that can lead to a fall. So I like to have the furniture positioned in a way that's safe, so like the chair against the wall. We also want to ensure that they're not wearing loose clothing, as this could lead to them tripping on it, or like long pants past their ankles. We want to make sure that they're wearing appropriate footwear. So this means well-fitted, enclosed shoes. We want to avoid sandals and slides. And of course, we want to have the matching pair of shoes as well. And we want to make sure the walker or the gate aid is nearby. I know I've seen some staff members have put the gate aid or the walker far away because they don't want the resident or client to stand up. But this is counterproductive because if they try to stand up, they would like to have a fall. So it's still better to keep the walker in front of them, because if they do stand up, at least they got the walker to hold if the staff member's not there immediately. And we want to avoid loud areas with big patterns or colors in the house, as this can be confusing or overstimulating to people with dementia. And more safety considerations. So even before we even start doing all the exercises, we want to make sure that they are cleared by the GP to participate in exercise and physical activity, or that there are no limitations to what they can complete. So you also want to monitor their exertion if they're already doing exercises. So you can do this by having a conversation with them, and you can see how much they're puffing. If they're able to maintain a conversation, that's still a good level. But if they're becoming, very fatigued, heavy breathing, agitated, and really flushed, that might indicate you might want to stop. And you want to encourage short rest breaks as needed. You want to make sure that the clients are hydrated, especially like yesterday when we had 45 degrees. Very important. People at that age group are not as, their bodies are not efficient as ours in regulating temperature. So make sure you ask them for water, or even notice what's happening just by the visual expression, because sometimes they might not be able to verbalize that. And ensure they are not reporting a dizziness or feeling of faint. If they do, cease for the time being. And last but not least, care well-being. So self-care is very important for any of the carers who are looking after clients with dementia. So if you have any medical conditions or physical limitations, Then do tasks that you can assist with and do not go beyond your means to complete an activity. So seek additional assistance where needed, such as needing two carers or or, or, or getting the relevant equipment if required. And you might need either an OT or a physio for that. Perhaps get the physio or allied health assistant to help with the initial exercise sessions, to help offer ideas on how to run the exercises, tips and tricks relevant to the client. And also, if they have to deal with still agitation and aggressiveness, it would be also good to involve the GP in there for from the medication side to assist with that. Now, you also have to allow rest breaks for yourself along with the client. To allow rest breaks for yourself to do stretches, deep breathing, and rest. And seek community support for both practical skills and emotional support. So the key takeaways is we want to have regular, simple movements that support health and well-being. So remember that small, consistent efforts make a big difference. Safety and engagement are critical. Do not hesitate to seek help from health professionals. And taking care of yourself is just as important. And thank you. We also have the next webinar coming up on the 25th of Feb to discuss navigating changes with people with dementia. Any questions? Uh, Nikki, yes, physios can prescribe, we do prescribe walking aids. Yes, we can, yeah. So if you need a client to needs to be assessed if she needs a walker, definitely send a referral to us and we'll assess the appropriate walk for them. Any other questions? Can unmute your mics or write down in the chat. Yes, we do offer physio through telehealth. I'll just get back to one of the slides here. So yeah, we do provide telehealth services for dietetics, occupational therapy, and physiotherapy and speech pathology. Yeah. So if there's a particular client, send the referral and we'll review for that client. Yeah. We also have nursing services as well. Any other questions or anything particular you guys want to know or a particular client with dementia that you guys would like to discuss about? Yeah, nursing is just in Victoria.